Committee on Health Chair Senator Dennis Rodriguez Jr. says it's no longer just about finding ways to fix the Guam Memorial Hospital.
Because that approach doesn't work. It's a whole system of care. It's access to care for our people, ensuring that there's health insurance coverages that our people have, ensuring that the resources that we have on our community here, healthcare resources, supports the needs of our community.
This systems of care approach is part of the findings outlined in a report released Monday by a special GMH legislative task force created in April 2015. University of Guam economist Dr. Roseanne Jones is part of the 15-member task force and researched the state of healthcare beyond Guam.
My major finding was, while we look at the hospital, the rest of the world is looking at their health system. And so it was that change in focus of we need to look at the health system, not just the hospital. The hospital is just one piece of the health system.
And while the task force had initially focused on just building a new hospital, they instead have come up with at least 10 specific actions.
Our discussion really shifted from just building a new hospital to what can we really do to sustain, to change that business model. Because a new concrete, although very nice, it's not going to change the problem of our hospital.
The first part of the plan involves introducing legislation directing GITA to develop a request for information related to the transition of the government operation of GMH to a public-private partnership.
We're hoping that in the development of this RFI that I'm going to be pursuing through a legislative mandate, is that if we do get into this public-private partnership or perhaps a complete privatization of the hospital, that a new facility is part of that package.
Jones says other communities are moving toward this approach, where it's not just about providing direct medical care.
How to bring the hospital into focus with the system is what the legislation is all about. It's really about how do we provide the best quality of health care for the people of Guam and keeping it on Guam as much as possible. We have a tremendous leakage of health services that are leaving our island for other places.
Rodriguez plans to introduce the bill in the next few weeks. Rodriguez adds, with the selection of Peter John Camacho as the new GMH administrator, he hopes they can all work together to bring some long-term solutions to GMH.
He's very aware of the challenges that the hospital faces. I'm just hoping that he's also open to a different approach this time around.
You can view the entire report on todoguam.com. Reporting for Guam's News Network, I'm Ken Quintaniza.